So you have a patient who you've run labs on and you have found this. You know that the patient is in DKA. The very first thing that you are going to do is hang up normal saline stat. You cannot go wrong by adding normal saline to a patient of DKA. Right? So hang up one stat normal saline. So principle of management, first of all, we need to work with the volume. We have to make sure that the volume is correct. Now, why is this important that volume is correct? Work on volume, correct? The volume. Why? But why? So why do we correct the volume? Of course, number one, to stabilize the cardiovascular system. So if heart is in tachycardia, if there is vasoconstriction present, cardiovascular system itself is unstable. Correct? So one, you correct the volume. First thing you correct the volume for following reasons. Number one, stabilize CVS. That is the first thing. Right? So the heart, I did not make a heart here, so let's make a heart. So let's say this is a heart. It may be in tachycardia, vasoconstriction may be present, perfusion may be low. Correct? So the first need to correct the volume is to stabilize the heart and the cardiovascular system. That will do what? That would improve the perfusion, right? Now that would also reduce the stress. So what would happen as a result? Perfusion will improve, right? And stress on the body will reduce. What does that mean? When body is in hypovolemic state, when the tissue perfusion is less, body is releasing epinephrine and cortisols and other hormones to help itself. Sympathetic system is in overdrive. So body is in a stress management situation. In that, what are suprarenals releasing? We talked about it last time. What are these guys releasing? Catecholamines, especially epinephrine. What is epinephrine doing? Epinephrine is reducing insulin production, number one, and number two, making the peripheral tissue insulin resistant by working on the beta-2 receptors. So the problem with the epinephrine is that insulin is not working. Don't you need the insulin to work when you're managing DKA? Right? How would you make it work better? How will you make body more responsive to insulin? By reducing stress. How do you reduce stress? By countering the hypovolemia. So when you counter hypovolemia, when you improve perfusion, body stress level goes down, epinephrine reduces, insulin responsiveness improves. That's one. Then, so here, reduce epinephrine levels. We have to reduce epinephrine levels. You cannot start managing a DKA patient who is in stress and stays in stress. That's one. Second, when you improve the perfusion, what is the tissue that would really help you? Who is your friend in this whole body, in this situation? Kidneys are your friends. Why are kidneys your friends? Okay, one, but something more important. So the answer was they would decrease glucose by glycosuria, that is one, okay. But more importantly, kidneys can help you with the acid-base corrections. You cannot create outside monitors and then see how to correct the acid base if you have kidneys that are running, if you have normal physiology that is going on, and kidneys are looking at the acid base balances and saying, okay, I need to generate some bicarb, I need to throw some hydrogen out, I need to throw some potassium out. You cannot do that fine tuning that kidneys can do. So who do you want in your body to become your assistant? Kidneys. Just like you have assistant who are working with you in the lab, in the ward, here you need kidney to be your assistant. For that you need kidney to function. For that you need perfusion to improve. Because when kidney is not perfused properly, it is not working correctly. So one more benefit of perfusion is improved renal function. Look, you improve renal function and majority of your problems are going to go away. Do you know what you do actually? Here is what you do. This is the summary of DKA management. Improve renal function. Look at potassium levels so cardiac arrhythmias and arrest does not occur. Look at osmolality levels so cerebral edema does not occur. That's it. You have managed the patient.